Well, welcome. We're going to let people in from the waiting room, so I'll pause just a second to allow people to join us from the waiting room. Um, hi there. Welcome to our panel discussion on global health, development, and the pandemic. This panel is going to feature the Fresno State UN Compact. So we're very excited that the Ethics Center can co-sponsor this event with folks working on the UN Compact here at Fresno State. I'm Andrew Fiala. I'm the director of the Ethics Center here and a philosophy professor. We do these kind of events every semester, a handful of them every semester, and it's kind of cool that we've been able to make the transition to virtual reality. So thank everyone who's in Zoom land and everyone who is on Facebook for tuning in and watching us. Um, Before we begin, and I'm going to quickly introduce our speakers, and then I'm going to bring Nancy Van Leuven up to do a land acknowledgement in just a second. But I want to say thank you to Belle Vang, who is the producer. She's been working with me all year and doing a great job of making this kind of stuff happen. So Belle, again, thank you for everything. So as you probably know, our panelists include Antonio Avalos, who is a professor of economics. Miguel Perez, Dr. Perez is an expert in public health. We've got Dr. Julie Olson Buchanan, who is the interim dean of the Craig School of Management and Business. And then we have Professor Ganesh Lama, who is a professor of social work, and he's joining us from Nepal, which is so cool. So it's really a wonderful panel. And then I also would like to thank, before I introduce her, Nancy Van Leuven, who is an assistant professor of mass communications and journalism. I ran across her. She was introducing the UN Compact at an event earlier this year. And I said, wow, that's cool. I'd love to get involved with that. And Nancy, you've been so helpful and amenable, and it's really been a great opportunity to get to know you. So let me introduce Nancy Van Leuven, who will get us started with the land acknowledgement.
Thank you very much, Andy. And thank you everybody for who's participating in this. It's so wonderful that this institute exists to have this kind of workshop. So I'm here to do just a really quick land acknowledgement. And for those of you who haven't seen one before or heard one, it's just a formal statement that recognizes Indigenous peoples as traditional stewards of the land. And in the case of our campus, Fresno State campus sits in the midst of the San Joaquin Valley. It's a valley rich in the traditions and representation of Native American peoples and cultures. We are very grateful to be in the traditional homelands of the Yokuts and Mono people, whose diverse tribal communities share stewardship over this land. So we just want to take a little moment and talk about that a little bit. Thank you so much, and looking forward to the rest of our panelists.
Thank you, Nancy. I think that's a wonderful way to start. And thank you again for all of your work and your help making this happen.
Thank you, Andy.
I'd also like to say a shout out to Bradley Hart and Jim Boren, who met with us early on in a planning meeting for this too. So thank you to them as well. So now it's my privilege to introduce Dean Julie Olson Buchanan, who is the chair of the UN Global Compact at Fresno State. Dr. Olson Buchanan is serving as the interim dean of the Craig School of Business. She started that position in January of 2020. Before assuming that role, she served as interim associate dean of the Craig School of Business and also interim associate dean of the Kremen School of Education and Human Development, which tells you something about her administrative skills. I've also enjoyed getting to know you this year, Dr. Olson Buchanan. So thank you for joining us. I invite you to take the floor. I'm going to post a little bit further about you in the chat if people are interested. So Dean Olson Buchanan, welcome.
Excellent. Well, thank you so much. It's an honor to be here, and I'm so excited to have this session and to join so many great entities here on campus. So I'm going to start with a video, and that explains a little bit about the United Nations Global Compact and Fresno State. So Belle, if you can start.
I'm Julie Olson Buchanan, and I am serving as chair of California State University Fresno's United Nations Global Compact Steering Committee. I'm honored to lead this effort because Fresno State is already engaged in such important work, and this gives us a framework to work across schools, colleges, units, and areas within the university to make a difference in our community and globally. Fresno State is now part of the United Nations Global Compact. In fact, we are the very first university in either the CSU or UC systems to join this international commitment to align our operations and strategies in support of its 10 principles. The Global Compact is a voluntary call to action, and it is also the world's largest corporate sustainability initiative, with nearly 10,000 for-profit and over 3,000 nonprofit members. As a member of the UN Global Compact, we are making a commitment to end poverty, protect the planet, and improve the lives and prospects of everyone, everywhere. In these areas, we are already doing excellent work. These are just a few examples of the myriad of ways that our university is working toward achieving the UN mandate and making the world a better place. I know you can think of many more. Now let's look closer at the 10 principles of the UN Global Compact that are presented in 4 major areas and provide the overarching framework for the Global Compact. Work under human rights includes our curriculum and research in this area, as well as our Dreamer students, plus programs in student and academic affairs, faculty affairs and human resources, and our cross-cultural and gender center. Labor examples include our curriculum and research, as well as our workplace quality efforts and our union context. Environmental efforts include the Sustainability Club, Fresno State's Transportation Institute, and most recently, the Bronze Award given to Fresno State by the Association for the Advancement of Sustainability in Higher Education. Anti-corruption is a focus of our curriculum and research, as well as many campus programs, such as the Ethics Center and the Institute for Media and Public Trust. We appreciate and want to continue to recognize, encourage, and communicate the leadership you are already taking to address the 10 principles of the UN Global Compact and the 17 Sustainable Development Goals. Here's the contact information for committee members. As you generate ideas about projects, curriculum, or partnerships, let's keep talking.
Thank you, Val, for showing that. As was mentioned in the video, we are part of a global corporate sustainability initiative. So here at Fresno State, and it is the largest in the world. With that, we are taking an oath to work toward these 10 principles of the UN Global Compact. And they're arranged around 4 buckets, including human rights, labor rights, the environment, and anti-corruption. And we're also making a commitment to work towards supporting the UN's Sustainable Development Goals. And there are 17 Sustainable Development Goals. They do change over time. This set is focused on achieving these goals by 2030. And before that, we had the Millennium Goals that were replaced in 2016 with these Sustainable Development Goals. So the Global Compact is 20 years old, and it is based on the idea that we can and we should make the world a better place through partnerships. And businesses are a force for good. And by walking the talk in how we operate as an organization at Fresno State, we're drawing attention to these issues and encouraging others to do the same. So we are one of only a few universities in the nation to be a participant. There are more universities worldwide, but it speaks to Fresno State's community, our focus on the community, and our focus on the globe. So with respect to today's topic, of course, as you're watching the video, I'm sure you saw a great deal of connection with what we're going to be discussing today, with what our fine panelists will be discussing, including, of course, human rights. So principle 1 of the 10 principles it's drawn from the Universal Declaration of Human Rights, and it includes the right to a standard of living adequate for health and well-being, as well as principle 10, which speaks to anti-corruption, could, of course, have a role here. With respect to the Sustainable Development Goals, SDG number 3 focuses on good health and well-being. So it's squarely in that SDG, but really any improvement, any progress on the 16 other SDGs would play a role in good health and well-being. I also want to draw attention to the UN's campaign that is entitled Only Together. And this campaign focuses on the call for vaccines for COVID-19 to be treated as a public good and to vaccinate according to need, including healthcare workers and to those who are most vulnerable around the world. So we have an amazing panel assembled today, and I look forward to learning from these experts as we explore these issues.
Thank you, Dean Olson Buchanan. Again, how exciting that we could do this really cross-campus collaboration. Just thinking about the colleges that are represented here, I think this is really important work for our university. So again, thank you for leading the charge on that. So what's going to happen now is I'm going to bring our panelists up one at a time. Each panelist will have about 7 minutes or so to present an opening set of remarks from their perspective. Then we'll have plenty of time towards the end, hopefully about 15 minutes to have conversation among the panelists and Q&A from the audience. But I'm just going to tell you, we're going to do Q&A through the chat function. So think of your questions as we go. If there's something you want to post to the chat in terms of a productive civil question, I would encourage you to post civil comments in the chat, and then we'll try to make a conversation happen in the last 15 minutes. So the presentations will go Dr. Avalos, then Dr. Lama, and then Dr. Perez will be our last presenter. So it's my honor and privilege to introduce my friend, Dr. Antonio Avalos, who is a professor of economics. And I've known him for a long time because he's been a ardent supporter, strong supporter of the Ethics Center. So Antonio, thank you again for your friendship and help with all of that. Just a quick introduction, and then I'll post more in the chat. In 2003, Antonio Avalos earned a PhD in economics from Oklahoma State University, where he specialized in economic development and international economics. His areas of expertise also include forensic economics, economic impact analysis, and political economy in Latin America. He's worked all over the world and thought about lots of issues from a variety of perspectives. So I want to get out of the way and give him his full time. So Antonio Avalos, the floor is yours. Thank you for joining us.
Dr. Fiala, Andy, thank you so much for such a wonderful introduction, and thank you for inviting me to this wonderful panel along with my wonderful colleagues here, especially for this very important topic today. Since I am the first presenter in the panel, I thought it would be a good idea to present a global perspective, a very high-level type of introduction to this. And in order to do that, I am going to take the liberty to share my screen so I can show you some slides that you should be able to see that. I am not going to launch the presentation on purpose because sometimes when I do that, things don't go well. So I'm doing this on purpose, but that's okay. So let me start by saying a few things regarding well, COVID around the world. As you can see on the screen, and as you probably know, right now we have around 8 billion people living on the planet. 7 of those 8 billion are living in the northern hemisphere, and the other billion or so are living in the southern hemisphere. So it's not surprising to see that the larger number of deaths due to COVID are happening in northern countries, in north of the Ecuador, right? So, and you know, we can go back to this chart if you want to discuss how the seasons of the year interact with each other because they are in reverse and things like that. But what I am trying to say here is that, you know, based on this distribution of the population around the world, it's not surprising to see again that most of these unfortunate losses of human life are taking place in you know, north of the equator. What is surprising, for example, is that, you know, out of the 800,000 deaths that I'm talking about, more than 2/3 are happening or have happened in the US, one country. In the case of South America, we're talking about Brazil taking the lead. And in the case of in the case of Africa, well, South Africa is the leading country in the number of deaths. I want to go back to this point in a few minutes because some of you may be thinking, well, what about the weak health systems? What about the underreporting? What about the lack of testing in many of these developing regions? So I'm going to have to rely on the expertise on some of my colleagues, perhaps, to tease this out. But hold that thought for a second. Specifically, I want to right now in this slide speak about Africa, because like I said, in May of 2020, if you compare the death rate of any African country, Algeria being the highest with 1.2 per 100,000 people, it pales in comparison with what we have, for example, here in California, which is 144 per 100,000. So you may be thinking, what's going on? What's going on in Africa? They are not doing that bad as we normally would think, because like I said, the safety nets, the health system in those countries is not as strong. But well, as we will see, there are a few complicating elements that are going to hopefully shed some light into this conversation. Before I do that, I also want to show you, speaking about safety nets, that unfortunately, this distinction and this divide in the number of deaths across countries also cuts across levels of income and financial ability to assist this population. So for example, on the screen, you have the percentage of GDP that is devoted to fight COVID around the world. And the bluer the country, the darker the blue, indicates that they are spending more of the size, relative to the size of their economy fighting COVID. And obviously you see places like Africa, some places in South America, some places in South Asia that are not faring very well. So let me go back to the point I was raising before. So yes, richer countries, because of the location and because of different factors, are registering the largest number of deaths around the world. Well, relatively speaking to lower income countries like Vietnam, India, Ethiopia in Africa, and others. So like I said, yeah, it is possible that there is less testing in these poor economies and weaker health systems, but, and this is something that perhaps my colleague, Dr. Perez, can, inform and can contribute to the conversation. It is also true that in these poor developing economies, the populations are younger. And we know that younger populations are not exhibiting as large numbers of death rates and cases. Fresh air helps. In many of these communities, homes have no windows, literally. So circulation of air, it's important. They also are more exposure to sunlight, which according to some reports I've read, also produce a higher level of vitamin D, which produces a higher level of immunity, right? Immunity may not be uniform. And also important is the fact that health policy matters. Different to what we did in some countries, in some rich countries, including our own, in many developing countries, they got their act together really fast. They knew what they needed to do. They are more used to this type of situations, and perhaps that's why they reacted faster than we should have. But anyway, I hope that my colleagues here can help me to tease out whether these lower numbers in developing countries are due to under-testing, weaker, or is because the characteristics of these countries are completely different to what we are used to in this privileged first world that we live in places like the US. Now, let me switch topics really quick to another point. I think it's very clear that the vaccines are effective. So these numbers are for England, and these vertical red lines indicate the date in which they start inoculating people. So, in just a few days, you can see declines in the number of cases, the declines in the number of hospital admissions, the number of deaths. So if you look at charts like this for other European countries, even for the US, it's very encouraging, despite the fact that we still have some people a bit reluctant to get vaccinated. And we can go back to that point later as well. Now, the key question here that I want to raise is, we can produce enough vaccines for every human being on the planet if rich countries share. And I want to explain this very carefully. Here on the screen, you have blue countries or bluish countries as the ones that have ordered the number of vaccines that exceed 1 or 2 doses for every member of the population. So Canada is a dramatic example. They can inoculate 3 times their population already right now, right? Compare that to Iran, Iraq, or other orange countries, right? So let me explain why I think this may be happening. As some of you probably know, because of humanitarian reasons, and this is a very noble effort. I'm not trying to diminish the value and the the interest in achieving this goal. As you know, the COVID-19 Vaccine Global Access, COVAX, is an initiative aimed at achieving equitable access to COVID-19, the vaccines, right? And of course, the World Health Organization is behind, UNICEF, some private entities, including the Melinda and Bill Gates Foundation and other people around the planet, which is fantastic. What sometimes people don't understand is that COVAX is split in 2 sections. So the first section is the one that is getting a lot of attention, which is the COVAX facility. And this is where self-financing countries, meaning those countries that have the ability to pay for the vaccine, are pooling their resources so that they can negotiate a much better rate with the manufacturing companies, Pfizer and the others. And of course, this also guarantees payment. It concentrates information. There is a lot of advantages of pooling resources and pooling information into one particular place. The facility, COVAX facility, is working really well because if you have the ability to pay, fine, you just join the facility and you have access to all these resources. The second part is what they call the AMC, which is the Vaccines Advanced Market Commitment. And this is for countries that don't have the ability to pay for the vaccine. So these funds depends on the philanthropic spirit and the donations from other countries. This is very important, guys, because I don't know what the numbers are, but last time I checked, they were not even close to reach the minimum to satisfy the number of people that are knocking the door at the AMC. So, this is what I mean when I say, I think we have the capacity to produce enough vaccines, but they are not free. Somebody has to pay for it. And some rich countries can do it, but many countries in Africa, in South America, in East Asia or South Asia cannot do it. And that's something that is a bit troublesome, for many reasons. I'm going to stop my comments here because I want to hear my colleagues too, but I think this is a good start to get the conversation going. So I'm going to stop sharing my screen and give it back to you, Dr. Fiala.
Yeah, Dr. Avalos, thank you. I think that is a good start to the conversation. And let me now introduce Ganesh Lama, who is coming to us from Nepal, where it's 4 a.m. So thank you, Dr. Lama, for getting up early and joining us. Quick introduction, Dr. Ganesh Lama is an associate professor in the Department of Social Work here at Fresno State. He has a PhD in social work and social development from Washington University in St. Louis. I'll post a little bit more about him in the chat. Dr. Lama, the floor is yours. Thank you.
Oh, thank you, Andy, for your kind introduction. And also thank you for recognizing the land of the indigenous people. I'm speaking actually from Nepal. I am an indigenous a person of Nepal, and I say that because we have in Nepal 2 groups of people. One group is the indigenous Himalayan people that I belong to, and then other one is the who actually controls the government. And I will speak a little more to that in my slide. And so, and thank you, Dr. Julie Wilson, for sort of giving introduction on Global Compact. And I'm just learning about that through your videos and also from website, on your website. And so trying to kind of match between the Sustainable Development Goals, about which I'm a little more familiar with some of my own work on poverty and development and for Dr. Antonio Avalos for giving this global picture of how unequal the world is and what that really means in terms of this COVID. So I will, hopefully my presentation will sort of translate, contextualize what Dr. Avalos has said in terms of, I have some pictures, so maybe that will speak for itself, okay? Let me share my screen now, and if I can, okay, that is, okay. Does everybody see my slide? Okay, maybe, let's see what happens if I do. Okay, I guess it does. So this is the Sustainable Development Goals, as Dr. Julie Wilson already showed it. And so the number 1 is the no poverty. We want to create a world, poverty-free country, really a novel goal. 0 hunger, okay, good health, quality education, and so and so. And those of you who are already familiar with the work of the United Nations probably should know all this. And Sustainable Development Goals came as the extension of the earlier goal, that was the Millennium Development Goal, right? And I think this Global Compact is the subset of that. If I'm understanding correctly, that is that's the partnership with the business world, right? And so, and these goals, when you look at this is quite novel, noble, right? And sentimentally very, very appealing, and especially for me, and particularly for my discipline and social work, where we wish to make this world a better place to live and help people live a better life. That's sort of the stated mission of our discipline profession. So the reality, though, because this is the ethics lecture, so I wish to speak to that, is that while these goals are very, very appealing sentimentally, it's very, very difficult actually to implement in poor countries, precisely because the role that the UN plays for other poor countries versus the rich countries. So when we live in the United States, the UN looks very different. But if you're looking at the UN from developing countries, then it looks very different. So allow me to give a little perspective on that, okay? So this is the picture I just took a couple days ago, actually a couple of weeks ago. And so here is a picture of a development. This is an indigenous land up in the mountain, very close to Mount Everest. Many of the people in this village did not have electricity or road for a long, long time. This road was built about 5 years ago. This road is the highway. It's like a freeway in the US, okay? It's a dirt road, and they're very happy to have a road. But the problem here is that the road can only be used by those who have cars, who can afford to ride a bus. So most of the people who live in the land, in the village, do not have access to the bus or any sort of transportation vehicle. So they use for carrying, they're carrying these dry leaves for feeding their cows or cattle, and also as a manure. Okay, this is sort of everyday life. So the UN, when you look at the report from the United Nations or any other UN development reports, which is actually the UNDP, United Nations Development Project Program, that is the one, that is the unit within the United Nations that is in charge of all implementing all the sustainable goals, they will really put a very colorful report about how they actually help the people by developing roads, but this is how the roads look like. Okay, so there's a road, but the people have no access to transportation, and that is really the biggest of the problems. And here I'm going to give a picture of the. Please do not take it this as a criticism. I kind of sounded like critiquing. So I really love the development goal. I think this is something we really have to engage and make this as a part of the curriculum, to which I'll speak in later. But just want to give a picture of translating what Dr. Avalos talked about, some of the inequality issues in the world and just how difficult it is to implement those goals in countries, poor countries like Nepal. And biggest problem, I would say, is the corruptions in the country. We have governments that are a member of the United Nations, the governments which are actually very known for corruption, and the UN largely rely on those corrupt governments to implement these goals. And here is the case in Nepal. Here you'll see the vehicle that is the United Nations vehicle. That vehicle is worth about 30 times more than average people's home in the villages, okay? And nobody can afford to ride on those cars. On the streets, you'll see cars that worth maybe 10 times less. And then the countries like Nepal prides itself, the biggest achievement of being part of the United Nations is not those development goals, but that they can send Nepalese to the UN as a peacekeepers. So UN works as a huge employment agency. It's a status issue. If you're connected with the United Nations, you are employed there, then you are a superhuman. This is really the case in most of the developing countries. That's the reality. So let me give my observation of how the UN looks like from the developing countries perspective, and from also the having lived in the US, what the UN really is, and what legal authority it has, what kind of capacities and resources it has in order to implement those goals. Okay, so UN to me, and from my observation, is simply in what we call international non-governmental organizations, or NGOs, sort of charity nonprofit organizations, whose primary goal established in the beginning was simply to prevent World War III, right? And so that's why we have Social Security Council and so and so. But in more recent decades, so the UN has been known or engaging more into development projects, which is a type of nation. So we have seen many different work around that project. And the sustainable goal, development goal, is the sort of latest of those nation building projects. Okay. And if you are familiar with the argument, thank you, Andy, for sharing the Guardian article, that really is the sort of the extension of the argument that was made by Jeffrey Sachs at Columbia, and Bill Esterly at the NYU, sort of an idea about that the rich countries should help the poor countries, which is Jeffrey Sachs' idea, and the Sustainable Development Goal is sort of his brainchild. And then we have Bill Esterly, who thinks it is all white man's burden, therefore, why bother, right? And so this sort of larger background argument on what should be the role of the rich countries towards the poor countries, and should we think about whole humanity as one people of the one world, or should we have a different sort of a sovereignty idea? So UN somehow comes in between those two ideas. One idea that have a global government. Sometimes the UN does act like a global government for the poor countries, But in the rich countries, UN looks like a small nonprofit that is asking for donations and support from the richer countries, right? And so, but real problem is that the UN because it's a charity sort of organization, it has no people's mandate. Nobody's elected there. So although it is really very important goals, but they really have no teeth how best to implement those things. And another problem I see is a heavily top-down policy entity where there's very little input from the ground up. Very poor people have nothing to say about how their own countries should be developed, how their language should be developed. And these policies are informed not by the people's reality, so to speak. And in more recent years, as I said, the UN has become more of an employment agency, sort of a heavily bureaucratic, and there's a asymmetric distribution of access and resource opportunities to the UN. Who gets to work at the UN becomes a very, very important political and status issues in developing countries. Okay, so for me, as a university, the way I look at it is that the UN still is a very important entity. We must engage with them. I think the goals are very noble, that are very complementary or related to what we do as a scholar, and therefore I view UN as an important, placement practicum agency, like a field agency where we can place our students to engage with the broader world. Okay. Just a quick pick. So this is sort of how Nepal looks like. If you look at the UN report, this is the UNDP Nepal report, where poverty rate is 21%, 21.6%. The per capita income is $1,000. And then the under 5 mortality rate is 38. Now, if you look at this theory combines what we call the Human Development Index, they're like 147 ranking. So these pictures are quite elusive because 21.6% poverty rate is based on about like $1 a day income. But where I'm living right now in Nepal, in the village that I'm right at the moment, 100% of the people are unemployed. Okay, they're subsistence farming. They have no really source of income. And if you look at the $1,012, that is, I mean, you cannot survive in America. So in the US, about $27,000 for family of 4 is considered under poverty, right? So it's a very different measures and definition of what a poverty means. So translating these things and, and really trying to achieve those sustainable goals in different contexts becomes quite a challenge. And how to educate our students, even try to maybe engage our student in this context becomes a bigger challenge. But I think having understood those difficulties will help us better prepare our students to engage in the global world. Here, just I think.
Can I jump in? And I just want to make sure we have enough time for Dr. Perez to speak. Okay.
Sure.
Yeah. Just.
No, I think I can stop right here. Yes.
Go ahead. Tell us about this photo, and then we'll move on to Dr. Perez.
Okay, this photo is the one of the global compact was the corruption, and so I wanted to show the picture of a corruption. This is a house on the left. Here is the house that was with people still living in that shed. In 2015 there was a big earthquake, and people haven't been able to build a home yet. But the government used the money here on the right side is the big building up here. That's the police station in the village. So people live on down there, but the government used the money to build a police station where people have no home. So that's the type of corruption that you will see in the developing countries. Okay. So I just wanted to show that picture. So
yeah, no, that's powerful. Thank you very much.
Let me stop share.
And thank you again for getting up at 4 a.m. and joining us, sharing this with us. It's amazing what this technology is doing. It's really kind of cool. So let me now introduce Miguel Perez, and then take whatever time you need, Dr. Perez, and we'll have some conversation after this is over. So Dr. Miguel Perez is a professor in the Department of Public Health. He has a PhD in health education from Penn State. He's a co-author of a couple of books, and I'll post the titles in the chat. Miguel, the floor is yours. Thank you.
Thank you very much. I appreciate the opportunity to participate in this very fascinating panel alongside two very distinguished colleagues and people that I truly appreciate working with. Just to kind of close our discussion and open the floor for discussion, I just kind of wanted to I want to share a little bit about what is taking place in regards to COVID-19. I think for the last 365 days or so, our lives have changed. But I want to take the next few minutes to highlight how COVID-19 has really impacted us in terms of inequalities, access to healthcare, and health literacy to a lesser degree. And I'll be building and touching a little bit on some of the topics that Antonio had mentioned before. So about a year ago, the World Health Organization gave a name to something that had started happening around the world. It started in a province in China and spread throughout the world. As we know, pathogens don't require visas to travel. And so before we knew it, something that was very localized became a global pandemic. And within months, our lives had changed, our lexicon had changed, and our way of living have changed. We have been telling people for a long time in public health that we need to wash our hands on a regular basis, but we do know that not everybody follows those recommendations. We were soon introduced to the concept of social distancing. 6 feet, 2 meters, what's the difference? Metric versus royal system. We started telling people that they needed to cover their faces, and that generated political discussion related to individual freedoms versus the prevention of death. These are solid public health measures. And as we know, they've been very effective in controlling the spread of SARS-CoV-2 in the last year. But they have also highlighted significant inequalities around the world. For those of us fortunate enough to live in a high-income country such as the US, washing our hands on a regular basis is relatively easy. But people who live in the developing world, in middle and low income countries who may not have access to running water, it becomes extremely difficult to adhere to this recommendation. In the US, we can acquire masks, and depending on how fancy we want them to be, they can go from a few dollars to expire. I see them out as expensive as $20-$30, depending on how fancy we want to be. But again, we have the luxury of being able to afford that cost. That is not always the case in countries where we don't have the kind of income resources that we have in the US. But regardless of our ability to engage in prevention, this virus has affected all of us. And I just wanted to share some figures with you. Antonio, thank you for doing the world. So I do have US and local figures to share. And this is what is happening. The total number of deaths in the US has exceeded 500,000 people. And I believe Dr. Avalo's presentation mentioned, the distribution versus Northern and Southern Hemisphere as a proxy for income distribution around the world. We see the figures for our county here, Fresno County, and these numbers hide some significant differences by gender, by race, by ethnicity, by income levels. So just to take into account, in public health, we tend to think in terms of high-risk populations, low-risk populations. We do know, for instance, that the elderly, people above 65 years of age, are at a higher risk for infection. And this graphic, the Centers for Disease Control and Prevention is utilizing the age group 5 to 17 as the comparison group, and then calculates risk factors for other age groups. And so again, we see some inequalities, younger people versus older people, in the number of cases, in the number of hospitalization rate, and as well as mortality rates. And these figures, of course, being for the United States. If you remember, in the United States, the earlier manifestation of COVID-19 was back in Washington State and affected individuals who, elderly, who lived in certain areas. But these items are also obscure some other realities that we are seeing a year after this pandemic started. We are now seeing that there are variants of the virus that are making their way around the world. We know that, that we can continue to control, but there is still a lot of information that we don't know about this evolving pandemic. And I know that for many of us, we're tired of the lives that we live, but there's still so much information that we don't know. We do have a California variant of COVID-19. There is a New York variant that are rapidly spreading across the United States. That, in addition to the UK, South Africa, and Brazil variants that you may have heard about in the news. And so again, as these variants of the virus become prevalent, there are some things that we still don't know. Fortunately, public health efforts have been successful in controlling the spread of the virus. I showed you a few of them earlier. But we have also been able to add vaccines to the arsenal that we have to deal with this global pandemic. And in the US, 3 vaccines have received emergency use approval. And I put that in red because there's a very important distinction as to what emergency approval means. We don't have time, so we're not going to get into that. But right now, these are the 3 that are actually available in the United States under this emergency use approval. There are other ones there are other vaccines that are available. There is the AstraZeneca that you probably have seen in the news. It's been available in Europe. It is approved for emergency use in Europe, but there has been some controversy about some of the side effects that this vaccine may cause. And even though it's been declared safe by the equivalent, the European equivalent of the FDA, there's still some reservations that people have on that. There is also, you may not have heard, there is a Russian vaccine as well, and they've been working to produce it in Europe in order to make it available to more people around the world. And there is also a Chinese vaccine that China is using very effectively to distribute among low and middle income countries that do not have access to the 3 vaccines that have been approved in the United States at this point in time. So this is great. The good news is that vaccination rates are going up around the world. We can see the numbers for the US. We estimate that we're getting close to 30% of the US population having had at least 1 vaccination, but that is not the case around the world. There are many countries where many people do not even have access to the vaccine, and they don't have a timeline as to when they are going to have it. Even in the United States, the vaccination has not been equal across all groups. And there are some medically vulnerable populations who do not have access to the vaccine. But when we pull back and look at the world, we are going to see in our next slide that there are still over 100 countries in the world today that do not have access to the vaccine. Talk about inequalities. Over 100 countries in this world, populations in those countries do not have access to the vaccine. There are several reasons why this is taking place. High-income countries have been stockpiling the vaccines. Using Canada, they have pre-ordered enough doses to have 9 doses per person in Canada. It's great that they're willing to make this investment to protect the population, but those dosages are being stored and not being accessible to people in other parts of the world who would have it. The US has recently announced that it is willing to, and in the process of coming up to donate some of the AstraZeneca vaccine that it has acquired to both Canada and Mexico. And while that is a great thing, we already seen Canada has more than enough. And interesting that the US has decided to donate the AstraZeneca vaccine that has not been approved for emergency use in the United States yet. As Antonio mentioned before, the United Nations has created a program, the Vaccines Global Access. And as he mentioned, it actually comprises 2 areas: countries that can actually afford the vaccines and countries that will depend mostly on donated vaccines to protect their populations. And again, because production is not as high as it could be, the number of vaccines available through the COVAX program is still limited in many, many countries around the world.
Miguel, can I jump in and encourage you to come to a conclusion so we have
Absolutely. Absolutely. In fact, I'm getting there. Thank you, Andy. So what we have is, what we're looking at is there is still a need for us to move forward and take steps necessary to get rid of COVID or go back to our lives normal. There are certain things that we know are effective. I will encourage everybody in this group to be vaccinated, remembering that we may be turning the corner, but we're not out of the woods yet when it comes to this global pandemic. And so that is the end of my presentation.
Thank you so much. That was really, and thank you for reminding us to get vaccinated and wash. I mean, like, there's some common sense stuff here that really matters. We've already had a few people putting questions in the chat. So let me just pick one, and then you panelists, I'd love to have you guys talk with each other. It seems like one of the questions is, what are the obligations that the developed world has to the first world or to the developing world. And you showed in various ways these disparities and inequalities. What should we do? What's the right thing to do? What are our obligations in all of this? And you're welcome to talk about anything else you'd like as well.
Were you directing the question to someone in particular, Andy?
Yeah, Miguel, maybe you want to go first. What kind of obligations do we have in the United States, or like that example of Canada and the stockpiling and so on? What's the normative takeaway?
First of all, I think it's important for us to realize that these disparities exist. I don't know how many people realize that this is taking place. These are very important ethical implications, and I wish I had an answer. I don't. Obviously, the natural instinct is to preserve our own selves. And so it is not surprising that these countries are stockpiling vaccine in order to protect their vaccinations. But what is the implications to the rest of the world who will now have to wait in order to have access to those vaccines? And I wish I had an answer. Actually, I would challenge this group to engage in a discussion, and perhaps we can come up with one.
I have a different take, Miguel, and I am going to refrain from getting into the political economy of these issues, but I'll take a stab at this. I agree with somebody wrote this on the chat. The most important obligation that we have is to take care of our own first and foremost. But when you start stockpiling, well, that's probably not a good sign. And now the other thing I want to highlight here as an economic development person is that poor countries are poor for a reason, not because they want to be poor. I mean, if we go back to the relationships, colonialism, and we go back in history to, commercial treaties and foreign policy of rich countries towards Africa, Latin America, we can discover a lot of the reasons why these countries are in the state they are. So, I mean, when we think about COVID as a worldwide public health situation, I think it's a moral obligation for everybody around the world, because this is our home. We need to take care of our home. So we need to expand this idea of taking care of our own as human beings living on the planet. You cannot say, okay, I'm gonna only take care of my neighborhood and you are on your own, thinking about a city or a country. So I really think the answer is, to me, pretty obvious. We should be helping others now, or as soon as we take care of ourselves. But, I don't know exactly, like I said, what's the level of funding of the AMC under COVAX, but I would like to see the funding grow. Keep in mind the following, Uganda, for example, can print all the money they want, but the pharmaceutical companies are not going to take the Uganda currency. They need to generate hard currency, euros, dollars, Japanese yens. And of course, they don't have them or the capacity to generate them. So even if they want to, even if they save, even if they do what they need to do to come up with the money, well, they are not going to be able to pay because they need the foreign currency.
Ganesh, would you like to jump in on this?
Sure. I think we have a pretty good estimate. At least we know some estimate of how many people have died or infected by COVID. But what we do not know is how many people have suffered economically because of the policies related to how we responded to this COVID situations. I know personally a lot of people have lost jobs and are struggling economically, and it's a terrible situation. So so my take on this, and I think I would agree to some extent with Dr. Avalos as to whether these countries have obligation or not, really depends on the causes of disparity. And if the causes of disparity is one of colonization, then I think the countries, especially the European countries, I think US is a little special case. I think US historically became independent, as opposed to the colonizations of it. And so US is a, kind of, there's kind of exception to the US. But maybe European countries like the British, the Dutch, and the Spaniards, and others who have colonized other countries have become rich on the back of many poor countries. They do have obligation. I would be very much strong, and I think take that position. But in the U.S., it's a little tricky part. But I think I would want people to think it this way: like, if you're a rich person, do you have some sort of moral responsibility to help the poor? Think it that way, as an individual, as a personal level. Would you want to live just like maybe in Bombay in India, where you're super rich and you're living among the lot of slum dwellers? Would you feel comfortable seeing lots of people dying around you, and but you being really, really rich among them? I think it's a moral question, it's an ethical question. So the question of obligation kind of sound like as if we have a global government, should we tax everybody? You know, if the UN was a global government, each of the individual countries were the member, like a citizen, and should the UN tax rich countries, you know, such in tax as an obligation, right? I don't know for that, you know, like I'm not quite sure, and maybe a good idea, may not be, but it's a good idea to test on, to experiment on. So again, I think it's a question. If the rich countries can afford, and if it has some historical relationship with poor countries, then I think it has an obligation. If not, that it should at least have some sense of humanity, where those that have resources, those haves, should help have-nots. I think that's what I would say.
Thank you very much. I would suggest, I'm looking at our clock, it's 5 o'clock. If we'd stick with us, if everyone would stick with us for about 5 more minutes, and maybe we get one more point of conversation. One of the things that I saw in the chat has to do with the cost of the vaccine. And Miguel, I think it was in one of your slides, you showed there was a big disparity of costs of vaccine. How does that factor in? Why do they cost so much in some cases? And I'm thinking about, our dean from the business schools there, and is it okay to profit on this kind of stuff? Does the profit model work in terms of development? And then in the background, I'm thinking of that case of the road. Ganesh showed us that road that was built, and the just vast disparities of wealth. So I don't know if that gives you guys something to think about. Maybe Antonio, you want to take a stab at that first in terms of business models and so on?
Dr. Olson Buchanan, do you want to take that first?
Well, and I think this is, really what is driving our focus on the UN Global Compact, and that is that it is forming a partnership and contributing to a partnership worldwide. This is a worldwide issue, and it's going to take a worldwide solution. And while we don't have a worldwide government, we have a series of treaties, and we have some organizations that help facilitate communication across countries. We do have an economy that is shaped in part by some of these issues. And I think this is where we as an organization at Fresno State, and our partnerships with for-profit organizations through the UN Global Compact is a worldwide call to action. And that is to focus on the greater good in this case, because this has implications for individuals worldwide, and it's shaping the economy, it's shaping health, obviously, it's access to education. This is an issue that has enduring and lasting and devastating consequences. So I do think that this is where, businesses, this is what we are calling businesses to do, is to step up and identify what we can do in concert with one another to make the world a better place, and in this case, to respond to an unparalleled experience with respect to a pandemic. I would say one thing that reminds me when I hear the term hoarding is how we responded when we moved to sheltering in place. Is we did tend to hoard, right? We saw that on our grocery store shelves here within the United States, and it appears that we are doing the same thing with respect to a vaccine, although now it's between countries rather than within our local grocery store.
I just want to say that I think we need to make a distinction between cost and price. So different countries are paying different prices because manufacturing companies are practicing what in economics we call price discrimination, charging different price for the same stuff to different people. And the reason this is happening is because some countries are trying to negotiate outside of COVAX because they cannot make it into COVAX for whatever reason. And of course, alone cannot negotiate the same price as the whole COVAX group can. So, I mean, that's why this is important to belong to COVAX. The problem is that you will be dependent on donations and philanthropic motives, which probably are not happening as fast as we wish.
Thank you. Miguel or Ganesh, would you like to jump in on this? And then let's maybe last couple comments and then we'll head towards a conclusion. Miguel?
Just one quick comment. There has always been a tension between economics and health, and the importance that we place on profit making versus maintaining populations healthy. And I think that this global pandemic has really highlighted that conflict that exists. I think that some of the answers to the questions that looking at the chat are easy. The answer is, yes, we should share what we have. But as Dr. Olson said, when we were hoarding toilet paper, we shared that with our neighbors when they run out of it. And so this hoarding a vaccine is just a different level of do we purchase what we have, what we can, and then share it with somebody else. There are no easy answers. And I'm glad that we're able to start the conversation today to start thinking about some of those issues. But that just, from my perspective, there are no real easy answers.
My take on this is, I think the sectors like health should it be a profiteering business, or should it be more like a humanitarian nonprofit of a business entity is I think important questions to consider. When you see the headline on NY Times or WSA, Wall Street Journal, the biggest headline is that the stock market going up for this pharmaceutical company is not really how many people it helped save lives themselves, the reality of health industry. So I'm not saying that health industry should not be a profit-making business, but I think there has to be some level of balance between the two. The real goal, should it be a money-making, profiting business, or should it be really saving lives? I think that should determine the cost, the price of anything we do, including health products.
Thank you very much. And I'll try to wrap this up. And I mean, I learned a lot from your presentations, and I really am seeing the value of interdisciplinary conversations, right? I mean, we need more of this in our world, right? We need to be listening to each other across the disciplines. I'm going to post in the chat a couple of things to share that one was from Dr. Perez, was a link to the CDC website with some information. Another is a Guardian article that just came out yesterday morning, and Dr. Avalos referred to that. If you're interested, grab a hold of that, copy it, and paste it, and go read some of that stuff. So let me wrap up and just say thank you again to all of our panelists and to the UN Compact. I'm so glad that this is happening at Fresno State. It's a wonderful project. We are making a video of this that will be on our YouTube channel. So if you want to watch, or you know anybody else who would benefit from seeing it, you can direct them there. I'd like to thank our panelists, Antonio Avalos, Miguel Perez, Ganesh Lama, Julie Olson Buchanan. Thank you again to all of you. And especially thank you to Nancy Van Leuven, who started us out and who really inspired the whole thing. So once again, thank you all for joining us, and have a great afternoon and rest of the day. Bye-bye.